All right, it's working. All right, so my name is Denny Hanson. I'm going to be your provider today. Can you tell me your name?
My name is Rachel Davis.
Hey, Rachel, what's going on today?
Not a whole lot. Just been stressed here lately.
Okay. And I see here that you are 17, correct?
Yes.
So we'll assume that you're on this at consent of your parents.
Yes, my mom is here with me. But she is in another room right now.
Okay. Let me go over your history real quick, get some information on you since you're a new patient. Do you have any past medical history?
Let's see. No past medical history.
Ever had surgery?
No surgeries.
Yeah, immunizations up to date?
All my immunizations are up to date.
Do you, let's see, 17. When was your last menstrual cycle?
My last menstrual cycle started 2 weeks ago.
2 weeks ago, and
2
it was
weeks ago.
regular?
It was regular.
You have one every month, pretty regular, same amount of days?
It's at the same time every month, and this one seemed to be just like all the rest.
Have you ever been pregnant before?
No.
What grade are you in?
I am a senior in high school.
Senior in high school?
Mm-hmm.
You play any sports or anything like that?
Well, I was in the marching band, and I played basketball.
Okay. What happened to the marching band?
I just, I needed some more time with my friends and to do things before I graduated.
That's understandable. It's a lot of stuff going on senior year. It's a busy, fun year.
Absolutely. That's what I've been trying to make out of it anyway.
But you're still playing basketball?
Yes.
How's that going? Hanging out with your friends on basketball? Do you have friends that are actually on the team?
Yeah. I mean, there's, I have some friends, I'm sad to see it, end after this year, but maybe we'll have a good season.
Okay. That's good. Well, let's talk about what's going on today. I know you said you're having some anxiety. How long's that been going on for?
Well, I began noticing, this anxiety about a month ago. I tried to, fix it with my friends, hanging out, doing stuff with them. But that's just not helping.
Okay. What are you having it all day, every day, or are you having episodes throughout the day?
It's about every day. I have episodes of when it gets really worse. But for the most part, I've been experiencing it every day for the last month.
And have you ever had this before the month?
Not like this, some stuff before tests and before big games, but this has been more pronounced.
What about anything? Have you ever had to take anything for anxiety? Any medications prescribed by a doctor that they gave you for an anxiety attack, or ever been in the ER for it, anything like that?
Nope, never been to an ER for anxiety, and I don't take any medicines for it. I've taken ibuprofen every now and then for headaches. That's it.
There's a few things that I need to ask you, if that's okay with you. I want to, talk to you about, some questions that are important with this, and then talk to you about anything like smoking and illegal drugs. Is it okay if we have that conversation?
Yeah, I think it'll be okay.
First off, I just want to make sure you haven't had any thoughts of harming yourself or anyone else.
No.
You feel safe at home?
I do.
Are you in a relationship?
Let's see. I have been in a relationship, but it's been just the one person for the last 6 months. I've been seeing somebody.
Okay. And how's that going?
You know, it's been going good. You know, I've never had a boyfriend until then, but it's this one. You know, he's good.
And are you sexually active in that relationship?
I am.
Right. Do y'all use any kind of contraceptive, barrier method, anything like that?
Um, we use a condom. You know, it's just been the one time, but we did. He used a condom.
Good. But you're not on any birth control, correct?
No,
Okay. All right. And then what about smoking? Have you ever smoked cigarettes?
I do not smoke.
What about drinking alcohol? Have you drank alcohol in the past year?
Oh, wait, hold on. I do. I have smoked. I tried cigarettes once, but it tasted bad, so I've never done it again. Drinking though, I drink. I did start drinking while hanging out with my friends because they said it would help me relax since I've been so anxious here lately.
Well, did drinking help?
You know, it's not really seemed to help like they'd say.
How many times in the last month do you think you drank alcohol with your friends?
Let's see. Well, I usually drink about 3 to 4 wine coolers on every Saturday and Sunday for the last month, I'd say.
But that doesn't seem to really be helping with your anxiety.
Not really reducing anxiety. I don't know if I'm just not drinking enough or just, but it's not helping.
Does it seem to be ever make it worse?
Well, this past week I feel like it has, been getting a whole lot worse. So, and I don't think it has to do with the drinking, but if it does, then yeah, it's worse.
What about after you drink, you're out with your friends? Have you ever drank and drive?
Never, no, I've never driven under the influence.
And during the week, do you ever drink, or is it only on the weekends?
It's only on the weekends. I've never drank during the week at all.
Okay. I'm going to go through a few things with you, if you don't mind. There's a few little questionnaires we want to do real quick. Just kind of helps me take care of you and kind of assess your anxiety, if that's okay.
Yeah, that sounds good.
One of them is this audit form, and we'll go through it together. And we'll give a score of 0 to 1. 0 would be never, and 4 would be 4 times per week, and it kind of works its way like that. So 1 is once a month or less. 2 is 2 to 4 times. 3 is 2 to 3 times, and 4 is 4 or more times per week.
Okay.
Okay. And we'll just kind of go through this together and kind of go from there. So, how often do you have a drink containing alcohol?
2 to 3 times per week.
And how many drinks containing alcohol do you have on a typical day of drinking?
3 or 4.
How often do you have 4 or more drinks on one occasion?
I don't think I've never had more than 4. So with the last question, it was a 3.
Okay. How often during the last year have you found that you were not able to stop drinking once you had started?
Never.
How often during the last year have you failed to do what was normally expected of you because of drinking?
Never.
How often during the last year have you needed a first drink in the morning to get yourself going after a heavy drinking session?
Never.
And how often during the last year have you had a feeling of guilt or remorse after drinking?
Less than monthly. Not often.
Have you or someone else been injured because of your drinking?
Never. No.
Skipped one. How often during the last year have you been able to remember what happened the night before because of your drinking?
Never.
Has a relative, friend, doctor, or other healthcare worker been concerned about your drinking or suggested you cut down?
No.
All righty. So So that ends that one. And we're going to do one more. We're going to do one called the GAD-7. And we'll run through it real quick just to help me kind of assess your level of anxiety, okay?
Okay, I'm ready.
Alrighty, so kind of the same kind of thing, 0, 1, 2, 3. So 0 is not at all, 1 is several days, 2 is more than half the days, and 3 is nearly every day. Over the last 2 weeks, how often have you been bothered by the following problems? The first one is feeling nervous, anxious, or on edge.
I'd say about, more than half the days too.
Not being able to stop or control worrying.
I'd say 2.
Worrying too much about different things.
I'd give it a 3.
Trouble relaxing.
Maybe 2.
Being so restless that it's hard to sit still.
I'd give it a 1.
And becoming easily annoyed or irritable.
Probably 2.
And feeling afraid as if something awful might happen.
Maybe 1.
Alrighty, so just look at these real quick. So they're definitely, some current concerns with, obviously that's why you're here, is for anxiety. So we want to try and help you out. On the GAD-7, that's a 13, which is definitely, definitely backs up what we've got, going on here with your report of anxiety. And then on your other one that we did, the first kind of section is a 4, and it kind of helps me kind of go in through the next section. The one after that was a 2, which is definitely on the lower side, so that's good, but it's still definitely a concern. A question for you: when you talking about drinking wise, have you thought about cutting down at all?
Well, I don't think it's really, caused any of my problems. So I've not really thought about, stopping it. I've enjoyed it, hanging out with my friends.
Okay. Has there ever been a time with your friends where you felt like if you didn't drink, it would cause you more anxiety just being with them and not drinking?
No, not in particular. No.
What if we, had to say, like on the days where you drink 3 to 4, if you, were to go down to 2 to 3, do you think that would make any difference?
Yeah. Well, I think I could drop it maybe 2, instead of drinking the 3.
Definitely would be definitely a good thing to think about, and a good plan we could, do together is just try to, make a little bit of, headway in there just to cut back some on that. There's definitely the risk for alcohol at at your age at 17 is something that we definitely have studies on with the developing brain. So we do want to just be careful and be able to make good decisions. 3 or 4 wine coolers can definitely cause decision making to go down and reaction times to go down. So we definitely don't want you to drive. So does that sound like something you could do?
I think so. Yeah,
Okay.
I think I could.
So, and then, I know like we talked about earlier, you're 17, if there's, a time that you want to talk to your parents or anything like that, I could I could talk to them on my own. I could talk to them with you, or you could talk to them on your own. If you ever decided you wanted to do that, I would definitely be here to support you in that and, to try to help with some of these things that are going on with you. I think that on the anxiety level, I think what we should think about doing is to get you into some therapy. Have you ever had to go to like a guidance counselor or a psychiatrist for therapy?
I never have. What does that mean? Do I have to go to a place, or is it at school, or where do I go?
So they actually have some really good resources where you can do it on a telehealth, just like we're doing right now. And it's definitely have been shown to be very effective. It's definitely something that we can talk about and get you set up with for sure.
Well, that sounds like a good idea. I think I'd be interested in that. No medication at all. I don't need any medicine.
I think right now what we could do is start you with therapy, kind of see where that goes. and see if that helps you out and kind of go from there.
Okay. Well, I've not talked to my mom about drinking. Should I, should this be something I could, just talk to you about, or?
It absolutely is something you can just talk to me about. I do encourage, talking with your parents about it when you feel ready, and we can, kind of have that discussion, like I said, together or on your own. And it's totally up to you.
Okay.
And do you have any questions for me or concerns about the plan?
I don't think so. I think that sounds like a good plan.
All right. So what we should
Cool.
try to think about doing is getting you in with the behavioral health telehealth specialist within the next few days. So we'll get you that information, and then I want to hear back from you in 2 weeks and see how that's going. Okay.
Okay. Sounds good. Thank you.
You're welcome. Sounds good. All right, man. So move on to, what was the other guy's name? Roy.
Yeah, let me pull up. All right. There's Roy. Okay.
I gotta get his little.
All right.
I gotta get his little audit thing pulled up.
So all right. Hey, my name is Daniel. I'm a nurse practitioner. I'm going to, do your assessment through this telehealth this morning. What's your name?
My name is Roy.
Hey, Roy. Tell me, Roy, how have you been doing?
I'm doing okay.
How old are you, Roy?
I'm 16.
You're
Just been having
16.
some difficulty sleeping.
Some difficulty sleeping. What grade are you in, Roy?
I'm going into the 11th grade.
Going into the 11th grade. So your sleeping problems. How long have you been experiencing sleeping difficulties?
Um, it's just been the last few months. It just seemed like I have difficulty, just going to sleep on time, and then just during the day, I just feel tired all the time.
You said for about the last month this has been bothering you.
Yes, sir.
What has anything changed? I mean, have you been staying up later at night? Been doing more activities during the day? What's been do you know a reason why you've been having the sleeping difficulties?
I'm not sure. I mean, I spend a lot of time playing PlayStation before I go to sleep, and on my phone. So I don't know if that has anything to do with it, but that's really about it. I just can't get to sleep and stay asleep, and then I wake up and I'm tired all day.
Uh, do you know how many hours are you getting to sleep each night?
Um, I mean, I would say maybe like I get a decent still 6 hours, but I just, it takes so long to go to sleep and then I wake up a lot. So it's just like my schedule's kind of all off.
You said all you get is about 6 hours at night.
Yes, sir.
Before all this, you were getting about 8?
Yes, sir. Yeah, I used to sleep really well. I used to go to bed and then wake up for school the next day at a regular time and feel rested.
Do you play any sports or do any extracurricular activities at all?
I used to be on the debate team, but I decided that this year that I just wanted a break from kind of all extracurricular activities, try to spend some more time with my friends.
Has that been going okay? Have you been spending a lot more time with your friends?
Yeah, that's been going great. I've been hanging out with them, and they're the ones that kind of got me into playing video games. We hang out on the weekends, and and that obviously probably throws off a little bit of my sleep as well because I hang out with them so much on the weekends and we stay up so late.
Are they like a new set of friends? I mean, is this, are they some a newer crowd, I guess, that you've been hanging out with?
It's a newer crowd.
Are you missing like the debate team? Did you not have any friends at all that were on that with you?
No, I mean I've had a few, but most of my friends are just these friends that I'm hanging out with now.
Okay. And I guess before we go farther, do you have a parent that's there with you?
I do, yes, they're here.
Okay. And then they're okay with us talking without them being here?
Yes, sir.
Okay. So so how many days a week or how many nights a week are you only getting about the 6 hours? Is this every day or just on weekends or?
It's especially on weekends, it's way even less. During the week, I just stay up late and can't go to bed, and then I have to get up so early for school. But then on the weekends, we stay up playing video games and hanging out at my friends' houses, and so we really don't get sleep then. Especially because on Sunday we'll stay over there, and then have to go to school the next day, but we stay up real late.
Gotcha. Does your mom know? I mean, have you discussed this with her?
Yeah, I mean, she just could tell I was tired, so we've just been talking about it. That's why she wanted me to kind of get on and see somebody and see if there's anything we could do.
Okay. I'm gonna ask you a few more just health problems. Do you have any health problems at all that could you may be causing any of this?
No, just only things that I do is I have some like seasonal allergies that we treat. That's about it.
Okay. What type of medications do you take? Anything for that?
Just Zyrtec, 10 milligrams a day. I take
Okay.
it at bedtime each day.
Okay. No surgeries or anything I should be concerned about?
No, sir.
Okay. Has your mom ever said anything about you snoring really loud or?
No, sir.
No? Okay. Or, stopping breathing at night, having pauses or anything?
No, sir.
Okay. About, as far as, in the morning, when you get up and, you just really don't feel rested at all, correct?
Right. Because it
Okay.
takes me so long to go to sleep, and then I have to get up and go to school, so I just don't get very much.
Okay. Are you, I think you've already told me this, but during the week, as you play video games up until bedtime. So is that just your ritual right before you go to bed? Is in front of the game?
Yeah, I mean, typically I'll be on my phone or on the PlayStation, and I just look up and don't know what time it is, and I keep on going, and then you look up and it's in the middle of the night, and so that just kind of keeps me awake.
Okay. Yeah, I mean, we'll continue further, but do you think this is, something that you could cut down on? I mean, this, especially right before you go to bed, it's good to, reduce any of that extra stimulation, those type of games. Do you think you'd be able to, give this up at least, reduce it to about 2 to 3 evenings a week?
Yeah, I think that's probably something I could try.
Okay. Well, tell me, Roy, does your family, do they have any health problems at all?
My mom has a hypothyroid problem, and my dad's got blood pressure and cholesterol. He smokes and drinks, and then my grandparents, one of my grandmothers has passed away. She had a stroke and some heart attack and blood pressure. My other grandfather passed away. He had prostate cancer and blood pressure and diabetes and cholesterol. The other two that are alive, my mother's mother, she's hypothyroid and high blood pressure, high cholesterol, and then grandfather that is alive on my mother's side is got high blood pressure and osteoarthritis and high cholesterol.
Okay. Have you ever smoked cigarettes at all or used any tobacco?
I mean, I've tried it before, but not something that I've done all the time. I've just tried it with my friends. Just using some dip. We just I don't smoke or anything, but we just do the dip with them occasionally.
Okay. So I mean, have you tolerated this dipping well? It doesn't get you sick to your stomach, throw up or anything?
No, it doesn't
Maintain.
really cause any issues.
Is it something you could see yourself doing? I mean, have you looked in like, all the problems that it could cause down the road?
No, it just really hasn't been an issue. It's just an occasional thing with my friends.
How about drinking alcohol at all?
We drink sometimes on the weekends when we hang out at his house.
Okay.
Drink maybe one or two on Saturday and Sunday.
You drink it. What type of drinks is it? Is it beer or is it
It's usually beers.
usually beer? Okay. So just about one or two beers, just on Saturday and Sunday.
Yes, sir. And sometimes, it's a little more depending on if there's anything else going on. Like in the summer, we drink a little more.
Okay.
Typically, it's one or two.
So is that when you first started drinking? Was it was it this past summer? When you started hanging out with this new crowd?
Yes, sir.
Okay. So this past summer you've gotten with a new set of friends, and so you drink at least on the weekends one or two beers, but sometimes you drink during the week as well. Just depending on what's going on. Is that right?
Yes, sir.
Have you ever drank so much where you've passed out?
I had one episode where I woke up and did not remember going to bed. That was just over the summer in the last month or two.
Do you feel concerned about your drinking? Do you think it's a problem? Do you think it's something that you can control?
I feel like it's not a problem. I feel like I've controlled it well.
As you've had some family history of some alcohol abuse, right?
Gotcha. Yeah, my dad definitely
Okay.
does.
You said he's still living, correct?
Yes, sir.
Okay. How about any illicit drugs at all? Marijuana, cocaine? Have you tried anything like that?
No, I've never tried anything like that.
Okay. All right. How about relationship wise? Are you in a relationship, girlfriend, or anything?
I had a girlfriend over the summer, but I don't now.
Okay. Have you been sexually active?
No, I never have been.
Never have been. Okay. All right. Do you feel, have you felt, with being tired all the time, have you been, depressed or, anxious about anything or have any other, mental health, problems going on?
No, just the sleeping problems.
Okay. Is your school performance been affected at all? Do you do well in school?
I do okay. I feel like I don't do as well as I had been since I got off the debate team, but other than that, it's not too bad.
All right. Well, do you mind if I'm going to ask you, it's just a series of questions, so I can, help get a little better judge on, the severity of your drinking first, and and if then hopefully we can really target the reason that you wanted to have this meeting and the sleep issue. Okay.
Okay.
All right. This is an audit screen, and what I'll do is I'll ask you a series of questions, and you'll answer. Your score will be from 0 to 4. 0 being never, and then 1 monthly or less than, and 2, all the way to 4. Pretty much rating the scaling the level of how much you've been consuming alcohol. Okay.
Okay.
All right. Question 1: How often do you have a drink containing alcohol?
About 2 to 4 times a month. So 2.
Okay. How many drinks containing alcohol do you have on a typical day of drinking?
1 or 2.
And how often do you have 5 or more drinks on one occasion?
Less than monthly.
All right. And how often during the last year have you found that you were not able to drink, or you were not able to stop drinking once you had started?
Never.
Never. Okay. How often during the last year have you failed to do what was normally expected of you because of drinking?
Monthly.
How often during the last year have you needed a first drink in the morning, to get you going?
Never.
All right. How often during the last year have you had a feeling of guilt or remorse after drinking?
Less than monthly.
And have you or someone else been injured because of your drinking?
No, sir.
All right. And has a relative, friend, or doctor or other healthcare worker been concerned about your drinking or suggested that you cut down?
No, I haven't really told anybody that about it besides my friends.
All right. Well, I've gotten a 7 on this little audit scale. Okay. And we're going to just talk a little bit more about that. Obviously anytime, that you're, you get to this time in your life and you start, thinking that, drinking is an option. We're concerned, and just about, not just today, but not just your safety, but your just future. And, you're kind of, a number of 7 kind of gives us, more on the severe side. We're worried about, already having a problem with this, and, just concerned about, how you're going to continue to function, and just worried about, your future as well. Okay. Do you think, you think it would be possible that you could, reduce this number, and, if you're not, if you could reduce it to, just drinking, just every other weekend, and just, and just to cut that back, just so you don't develop a dependency that you can't get rid of? Do you think that's an option?
I mean, I guess I could.
Do you think you'll lose friends over this? Do you think this is going to affect, relationships, for the future?
I mean, I do sometimes worry that it would, it could, could get made fun of if I'm not drinking when I hang out with my friends. I mean, that's, something definitely could happen.
Well, besides, besides the drinking in general, I think that may be, have a lot to do with your, being tired during the day and your sleep, sleep problems, having a hard time sleeping at night. And then, I think we can all tie this all together. So, I think
Okay.
I think your issues all tied into one. So, I think if we can, if we can reduce the drinking and, and especially in the gaming part of it, and just at least have better times of the day, and just having a certain time in the evening where you cut this off, maybe, or 9 o'clock or something, and you just really
Okay.
cutting that down to less than an hour a day, I think would really improve your sleeping.
Okay. So don't stop playing at all, but I can still play. Just try to stop at like 9.
Yeah, you can still, be social with your friends, you got to make better decisions. So yeah, just cut the gaming down and really stop, at least at the minimum an hour before you decide to start your nighttime ritual and go into bed. Okay.
Okay.
And drinking wise, perfect world. Yes, I like, would like for you to stop, but if you can find a way to really just, reduce that, then I think it's going to set you up better. We're going to, not be as concerned about your future and your, and having issues with alcohol. Okay.
Okay.
With this, with a higher number as well, I would like to talk to you. Would you be willing to go talk to a counselor, if we can set up something?
I mean, I guess I could do that.
And this can, this can be just, just something between you and a counselor. It can be, I do encourage you to, discuss this with your parents. This is something that usually with the more support you have, the better, the better outcomes we have. So, but yes, I will get that set up for you, and we can they can do one, through this telehealth, or I can set you up an on-site visit with somebody so they can, really talk to you a little more detail about these issues bothering you. Okay.
Okay.
All right. But like I said, I think, the sleeping issues, it's tied into this. And I think if we can eliminate your big problem, or your problem that you had here, with the drinking can, can eliminate the sleeping problems as well. Okay.
Okay.
All right. Do you have any questions or anything for me?
No, sir.
All right. Well, we'll see. We'll have you follow back up. I'm gonna get you on for about 2 weeks from now. We'll meet and we'll do this again, and we'll see. Hopefully you'll have a few visits at the counselor. So hopefully we'll have some things we can talk about.
Sounds good.
All right.
All right.
Thank you.
Thank you.